As your Dubuque community pediatricians, we care deeply for the health of your child. We want your little one to grow and develop into happy, strong, smart, independent people. Most of this is achieved by you, their parent, providing them with love, healthy food, opportunities for play and exercise, and developing their intellect and creativity. Sometimes, despite everything we've done right as parents, challenges arise, and infections like flu, pneumonia, ear and sinus infections, or worse, can affect the healthiest of kids. We're here for you when those things happen, to talk, test, treat, and diagnose so that your child can reach their full potential. But even better than treating a disease is preventing it. And one of the best ways to prevent infections is through vaccinations.
To understand vaccines, it is important to understand the history of why we vaccinate in the first place. Just 100 years ago, 1 in 5 children did not make it to adulthood because they died. And the leading reason for this was because of an infectious disease. So what changed? The idea of vaccinations came because of a significant disease called smallpox. This was a disease that was devastating. Every century it killed about 300 million people. And if you didn't die from the disease, you became horribly disfigured. Then a man named Edward Jenner in 1796 noticed that milkmaids developed a milder version of the disease called cowpox, and they never got smallpox. So he took a small amount of that material and actually did what he called inoculating into a young boy who developed a mild case of cowpox, but he never developed smallpox, and he was then immune. Other diseases were able to follow suit like this. In the 1880s, it was the rabies vaccine. In the 1910s, it was diphtheria. In the 1920s, it was tuberculosis and tetanus. By the 1950s, we had polio vaccination, and in the 1970s, we had measles, mumps, and rubella vaccination. We don't grieve like families in the past for the loss of our children because we don't see these diseases anymore, only because we choose to vaccinate.
It's easy to forget the danger of diseases that we no longer see, but these diseases have not disappeared. Measles, for example, isn't just a fever and a rash. It can cause more serious complications such as pneumonia, brain swelling, deafness, and even be fatal in some circumstances. Pertussis or whooping cough can cause young infants to stop breathing and end up in the ICU. Meningococcal meningitis can lead to life-threatening complications even within hours of presentation. Polio used to cause paralyzing illnesses for children in the United States every year, but thanks to vaccines, we no longer have US outbreaks of polio. These infections will continue to circulate in the world, and some infections like measles have been rising again in our country. And if rates of immunizations continue to fall, we will see more and more of these vaccine-preventable illnesses come back.
Vaccines are one of medicine's greatest innovations, developed through decades of research, careful testing, and continual refinement. The idea is simple but powerful. Expose the immune system to a safe, weakened, or inactive piece of a virus or bacteria so it can learn to recognize and fight off the real thing later. From the time of the first smallpox vaccine in the 1700s to today, vaccines have evolved substantially. Today's vaccines are safer, more targeted, and more effective than ever before. Biologically, vaccines work by training our immune system, specifically our B cells and T cells, to recognize invaders. Vaccines don't overwhelm the immune system. They engage it in a focused way, helping it grow stronger and more experienced in recognizing danger.
We understand that some parents have concerns about vaccines. That's okay. It's natural to want to protect your child. Remember, we are parents too, and we understand the second thoughts that arise whenever a big decision affects our child. We're here to listen and also to share what we know as physicians and scientists who have devoted our lives to children's health. Let's talk about a few of the common fears. Autism. This concern began in the late 1990s with a now discredited study that was thoroughly debunked and retracted. Since then, extensive high-quality research involving millions of children has shown no link between vaccines and autism. None. Chronic illnesses or immune system overload. The immune system encounters thousands of new microbes every single day. The small number of antigen in vaccines is minuscule by comparison. In fact, Modern vaccines are more refined than those used decades ago and contain fewer immune-stimulating components overall. As pediatricians, we review the safety data, we see the outcomes, and we vaccinate our own children. We would never recommend anything for your children that we would not do for our own.
Our purpose as physicians, and specifically pediatricians, is the well-being of children, your children. We share your joys and worries, and we root for your successes. Our first-line defense against illness involves a holistic approach, a combination of healthy lifestyle and tried and true evidence-based medicine. With this comprehensive approach, we encourage adequate nutrition, good sleep, and plenty of physical activity. Now, vaccines and preventative health are all about risk reduction. Our goal is to minimize the risk so we can maximize time kids are where they belong, which is out of the hospital and at home with you.